When you look at dialysis in general, it's a very siloed healthcare system where you have devices that work only in the hospital or devices that work only in center. What Outset looked to do is surrounding innovation in water purification, surround that device with digital sensors, with a graphical user interface, really focused on patient-centered design, to create a device that goes across the entire spectrum of wherever dialysis is delivered, all the way from the intensive care unit to the home, and try to simplify that entire process.
Nihira provides smart, affordable, lifestyle-based hearing solutions to the millions of people today that are not being serviced with traditional hearing solutions. I'm actually wearing mine today, and it's a type of product that can be used across multiple parts of an individual's lifestyle. It essentially, regulation, price, and convenience have hindered the adoption and growth of the early-stage hearing loss market.
Alta Pharmacy is a full-service digital pharmacy, famous for our courier same-day home delivery. We have redesigned the pharmacy operating system. We've built our own system from scratch. We also have a patient-facing app bringing pharmacy to your fingertips. And we have grown by partnering with providers. So we have a provider product called Alta Connect, where providers can actually see what happens to the prescriptions after they write them, track adherence, and direct message us in between appointments, as opposed to dealing with fax and phone.
We're providing care to patients who have no other touch point to the healthcare system. 4 out of 5 of our patients haven't seen a primary care doctor in years, about 70% Medicaid. And so we've managed to expand access and also improve retention by about 3x relative to national Medicaid averages and industry brick and mortar averages.
Our product is a behavior change product for people impacted by cancer. So that's both cancer patients and caregivers. And really what our goal is to help people better understand their cancer and their recovery and what actions that they can particularly take to improve clinical outcomes. So for example, we'll take exercise. Exercise can reduce the risk of cancer coming back and reduce the severity of chemotherapy, but it's not something that's typically covered by clinical care teams, just they generally don't have the time.
Our approach has been to take a one-size-fits-none approach to deliver this care. We do it in kind of 2 ways. One is a machine and the other one is a human. So on the machine side, ABLE is built on the largest GI database in the world. And we utilize AI and machine learning to personalize a pathway through nutrition and a pathway through psychology that has the highest likelihood of getting someone better according to the data that we have and that we continuously gather from people as they utilize the platform in an anonymized and aggregated way.
Hypothyroidism, the treatment, has been generally the same for the past 75 years, and it's one of the most top drugs prescribed in the world, levothyroxine. A lot of patients come to us and they say their doctor has just given them this prescription and things haven't worked out, their biomarkers look fine, and they come to us because we take a very different approach. Our physicians, we have a team of physicians, endocrinologists, integrated family care medicine, registered dietitians, health coaches that are looking at this. They see trends and patterns from the thousands of hypothyroid patients that we've seen, and they can assess what are some of the different interventions that they can take on a personalized per patient level.
We want to use science to help you reprogram your circadian rhythm to fit in different scenarios where you need different sleep schedules. So that speaks to the individualization piece, because sleep is such a multifaceted problem and everybody has different needs and different conditions of sleep. So what we want to do and what we're currently doing on 2 levels. One is the front end, the other one is the back end.
NoRx Health is using machine learning technology to identify the probability of side effects in medication usage through patient-reported objective measures, along with connected devices and wearable devices. So the mobile application drives medication adherence, as well as health literacy and better communications with their care team. What we do specifically is look at the side effects associated with all medications and deliver health literacy content specific to them.
We're able to give you very detailed insights into mental health, respiratory health, and coming soon, cognitive health and cognitive impairment. And so our whole platform is built on the world's largest, deepest, most diverse voice data set.
We believe that we could do something better, that we could build a platform that could first and foremost measure what is happening within the neurophysiology of each individual, and then build real-time adaptive interventions. I'm excited to share that our first product is called the Psionic Neural Sleeve, and it is a Lycra-based garment with sensors embedded into the fabric that measures one, how the muscles are firing, and two, the orientation of limbs in space.